This bleeding disorder presentation is based on the standard material produced by the Unified Referral and Intake System. It is intended to provide general information about bleeding disorders to persons providing lunch supervision in a school setting. There are several types of bleeding disorders which can vary in severity. When a person has hemophilia, one of the clotting proteins is lacking, so their blood does not clot normally. Von Willebrand's disease is another type of bleeding disorder caused by a lack of a clotting protein. With idiopathic thrombocytopenia, or ITP, an antibody coats the platelets and causes them to be destroyed. Platelets control and stop bleeding by causing blood to clot. A person with a bleeding disorder does not bleed faster, but can bleed for a longer time if the blood does not clot. For a person with a bleeding disorder, most bleeds are routine and emergencies are rare. If a child with a bleeding disorder has an external bleed, such as a cut or nosebleed, it is treated the same as for any person, with standard first aid. However, if the bleed does not stop, the parent may need to be contacted. If a child has a bleed in the joint or muscle, it will gradually swell, feel warm to touch, and become painful. The parent may need to be contacted. An internal bleed may occur if the child has a significant injury to the head, eye, neck, chest, or abdomen. An internal bleed can be life-threatening and requires medical attention. 911 will need to be called. If any of these situations occur, call for school staff to assist the child. Do not leave the child alone. It is important for persons providing lunch supervision to know which children have a bleeding disorder. Please review this information with your lunch program supervisor or school administrator.